Hello, my name is Lauren Bishop, and today I'm going to be doing a video on how to start an IV. I am first going to verify that I have an order for this IV. I see that I do have the order, so I'm going to gather my supplies. Get that up here. I'm going to go into my patient's room and identify that I have the correct patient by asking the patient's name and date of birth. Once they have given that to me, I'm going to check the ID band to make sure that it matches. In this case, it does. So I'm going to ask about any allergies to iodine. Any allergies to iodine, chlorhexidine, latex, or tape. I'm also going to assess the extremity for any ports or fistulas and ask about any mastectomies at this time. Also going to ask if they've had an IV before, if they've had any concerns or complications or questions. I'm going to then perform my hand hygiene. For this IV, I'm going to start with using the venous dorsal network. So I'm going to apply the tourniquet 4 to 6 inches above that site. And I want to make sure that my pigtails are up and out of the way, that I can place 2 fingers under the band and check for a radial pulse, which all are there. So I'm going to palpate the veins of the venous dorsal network. Here I feel that I've got a good one. At this time, I'm going to grab the gloves from my kit. And put these on. I'm going to clean the area with chlorhexidine for 30 seconds. The larger the area that you clean, the better. Alright. And you want to allow for that to dry. While I am allowing for that to dry, I'm going to go ahead and prime my syringe and my tubing. I've already primed my syringe, so I'm gonna do so with my tubing. Sorry. And I just want to check for any key kinks or leaks, make sure that it flows through okay, and it does. So I'm going to place this back into the package here. I'm going to get my tape out and pull me a piece off to have ready. And I don't want to put this on the table. I'm just going to place this here on my sterile package to try to keep it less contaminated. So once I've got that there, then I'm going to make sure that the site has dried. It has. So I'm going to grab my needle, remove the cap. I'm going to anchor the hand by holding the fingers down and pulling the skin nice and taut. I'm going to make sure that the bevel is up and insert the needle at a 10 to 30 degree angle. Okay, and I've got blood return, so I'm going to advance the needle just a little bit further here. And go ahead and release that. Slide the catheter off with my pointer finger. At this time, I will also engage the safety on my needle and hold the catheter in place to make sure and dispose of the needle into the sharps container. Engage the safety. I'm going to grab the gauze from my starter kit. Wipe off any of the blood here. I'm going to then flush at the site by using my pointer finger and my thumb to connect. Not releasing with that middle finger at all. I'm going to flush about 2 to 3 mils. And then I I can again use my pointer finger and my thumb to disconnect. I'm going to check around the site to make sure that the fluid looks like it has went into the vein and not the skin. If everything looks okay, then you can go ahead and get your piece of tape here. I'm going to tape it over. And once I've got it taped and I've got that catheter in place and secured, then I can let go with that middle finger. I'm also going to want to tape this here up out of the way, just because it can get pulled out kind of easily. So I'm going to tape this up here. Okay, and once I've got that taped up out of the way there, I am going to grab a current dressing back there. This tape is not wanting to stay. Okay, there we go. Okay, and I am then going to document this by putting the needle gauge, the date of the dressing change, the date of the insertion, and my initials. I would then remove my gloves and document in the chart. And that is all.